Good morning, everyone. I'm Farnoush Davoudi. I had the privilege to complete my practicum at UVic and BC Center for Excellence in HIV/AIDS. I joined a team that was working on community knowledge survey of HIV pre-exposure prophylaxis or PrEP, and that's how I came up with my culminating project topic, PrEP awareness and uptake among gay and bisexual men who have sex with men. I will refer to them as GBMSM or MSM for the rest of this presentation. Before proceeding, I'd like to thank my practicum supervisors, Dr. Lachowski and Dr. Hall, for providing such a great learning opportunity. I also like to extend my thanks to Carol, Syra, and Cam for their generous help during this and my other practicum projects. In the next few minutes, I'll give you some background information, explain how I conducted this project and what I found. I will elaborate a few important findings, and we shall be good to conclude this presentation. PrEP for HIV is the daily use of a fixed-dose combination of tenofovir disoproxil fumarate and emtricitabine by HIV-negative individuals. To prevent infection, the medicine is taken on an ongoing basis before a potential HIV exposure and continues afterward. PrEP was approved by Health Canada in 2016, and since 2018, it's available through public and government-funded medical benefits. Current Canadian guidelines recommend PrEP for individuals with high ongoing risk of HIV acquisition, including GBMSM, who meet certain criteria. When it comes to HIV prevention, GBMSM are a priority group. While this group represents less than 7% of Canadian male population, they comprise about 52% of all people who live with HIV in Canada and more than 45% of all reported new adult HIV cases in the country. When it comes to PrEP as a public health intervention, GBMSM are the target group. If we want to achieve the population level impact of PrEP, we need to understand how it is being embraced by GBMSM and learn what structural and individual level factors influence its uptake by this group. I looked into PrEP awareness and uptake trend and determinants in the literature. PrEP was recognized as an effective HIV prevention strategy among MSM in 2010, so it sounded reasonable to review studies published between 2010 and 2020. To obtain a more comprehensive picture, I included studies from Australia, France, Germany, the Netherlands, New Zealand, Sweden, the United Kingdom, and the United States as well. These 8 countries are recognized as Canada's peer countries by Canadian Institute for Health Information. And as you see, eventually there were 27 papers that met all criteria to be included in this review. Evidence shows that PrEP awareness has significantly increased over time. Well, but not everyone in MSM population is aware of PrEP. White MSM, those with education attainment greater than high school, those who live in capital cities, and individuals who have a personal income beyond the low income cutoff are more likely to be aware of PrEP. On the other hand, Aboriginal, Black, Latino, and other non-white identified individuals, bisexual MSM, those who live in rural areas, and individuals who use drugs are less likely to be aware of PrEP. PrEP uptake has increased over time too, but the slope is not as steep as we see in awareness curve. Again, not every PrEP eligible MSM takes the medicine. those with educational attainment greater than high school, those with higher income, and individuals who receive some sort of STI or HIV health education or service are more likely to use PrEP. On the other hand, Aboriginal and non-white identified MSM, individuals with low self-assessed risk of HIV acquisition, and those with limited access to PrEP providers are less likely to use PrEP. Well, there are a few points about this study that I'd like to discuss here. Number one, despite the significant increase in PrEP awareness, we should be mindful that many people who would benefit from PrEP are still unaware of its existence. Number two, disparities observed between PrEP-aware and unaware groups are highly suggestive of inequities in PrEP awareness. It's beyond the scope of this review, but let's just say that there are effective strategies to close the awareness gap between ethnic groups, socioeconomic strata, and rural and urban areas. Number three, current PrEP uptake is not enough to achieve its population level effect. In Canada, we need an uptake rate of 20% among GBMSM, but the study is estimated that less than 10% of Canadian GBMSM use PrEP. Number four, PrEP uptake is low partially because many PrEP-eligible MSM do not consider the risk of HIV acquisition high enough to seek prevention. Self-assessment tools for active HIV risk score are not helpful, but there is a good chance to help GBMSM understand their PrEP eligibility in HIV testing and counseling settings. Number five, accessing PrEP exclusively through specialists is an important barrier for PrEP uptake. Fortunately, current PrEP scale-up plans have considered nesting PrEP delivery within sexual health services and other existing primary care clinics. Oh, sorry, I missed one slide. Well, to wrap it up, let's say a decade after being introduced, PrEP uptake among GBMSM is still too low. There is a big gap between PrEP awareness and uptake, and several structural and individual level factors affect PrEP awareness and uptake independent of its availability and cost. And I'd like to add a few points about the study itself. Though it was not possible to retrieve eligible evidence from all peer countries, this review was an extensive and structured one, and I believe it delivers information fairly enough to understand PrEP awareness and uptake among GBMSM. But if you ever ask me to conduct another study to address PrEP uptake, I'd like to directly analyze administrative databases and EMRs for PrEP prescription and uptake. And last but not least, the review findings have implications for public health. Understanding the rate and trends of PrEP awareness and uptake helps to contextualize PrEP scale-up activities and optimize strategies for targeting and delivering PrEP to MSM. For example, the wide gap between PrEP awareness and uptake calls for strategies to increase willingness to use PrEP and PrEP acceptability among GBMSM, as well as strategies aimed to overcoming access and affordability barriers. Furthermore, identifying the inequity indicators informs policies to ensure more equitable HIV prevention among GBMSM. Well, thank you for your time, and I'd be happy to answer any questions.
That's great, Farnoush. You're right on the button in terms of time, so thank you very much. Fascinating talk. I'm sure there's going to be some questions. So again, anyone who has a question, Um, okay, Helen, please ask your question. I think, Helen, you haven't turned on your microphone. Okay, I don't see a microphone on Helen, so perhaps we could just move to another question.
Sorry, perhaps Helen could put her question in the chat box instead.
Good. Brilliant. You think far faster than I do. So, Helen, could you just send your message, question by chat? We are getting a little bit of an echo here, actually, right now. Maybe, Jeff, could you ask your question then?
Yeah, sure. Can you hear me okay?
Yes, thank you.
Thank you very much, Farnoush. It was an excellent presentation. It's a really important review. It also builds nicely on mine tomorrow, so I know where I can focus my presentation tomorrow. So thank you so much for me first. I just have a question about how you came across, I know you mentioned there the linkages between the importance of linking certain key populations, specifically kind of groups like Indigenous folks and people of color. If there was any strategies around how to link those groups to primary care providers, if you came across any kind of specific strategies, how you might do that.
I'm so sorry, Jeff, but there was a lot of echo and I could not get your question. Do you mind writing it down in the chat box or repeating it for me?
Yeah.
While Jeff's doing that, whoops, I missed Helen's. Hold on, I'm just going to send the message which we've missed. It seems to have gone off screen. I don't know if you caught it.
Hi, Nigel. I can repeat Helen's question. It's, hi, Farnoush. Can you explain what you mean by need 20% uptake GBMSM is required, that's in quotes, and compare that to actual of 7%?
Well, there has been some studies in Toronto, and there was some mathematical modeling.
Oh, hold on. Sorry, Farnoush. If anyone else has their mic turned on, can you please turn it off? We're getting a lot of feedback and we can't hear Farnoush now. Thank you.
No one else has their microphone on. I believe it's actually Farnoush's microphone that might be causing the problem.
Or maybe. Oh, well, getting back to Helen's question, there was a study in Toronto and they did some mathematical modeling and they concluded that if you have 20% of GBMSM on PrEP, there are probably enough number of people taking PrEP so that you can, reach the population level effect of the intervention. Means you have enough people taking PrEP to stop or halt HIV transition.